Right. So if you have read and understood, considering it surgical anatomy station, kindly please
Yes.
tell me what exactly are you looking at? Can you identify the image?
Mm. Yes, I can identify as a cubital fossa.
Okay. Can you identify from which side is it? Because this is also part of it. You're looking at the cubital fossa of left side.
This is a left side of cubital fossa.
Yes, left side. Can you please tell me the boundary of the cubital fossa?
Superior medially, superior laterally, it is bounded by the brachioradialis muscle,
Good.
and medially, it is bounded by the pronator teres muscle,
Yes.
and roof is formed by the skin fascia,
Yes.
uh, and the floor is formed by the brachialis muscle.
Very good. And the contents are, please, medial
And
to
the content,
lateral, if you can tell me.
yes, the contents are from medial to lateral are median nerve first, then profunda brachial artery, brachial vessels,
Which one is? Yes.
and the third one is a tendon, biceps tendon.
Yes, very good. Very good. Excellent. If you can now look at the image and identify number 6 for me, please.
This is the basalic vein.
Cephalic vein.
Yes, it is cephalic vein, right?
11. If you can identify 11, please.
It's a medial cubital vein.
Median cubital vein. Very good. And one last one. If you can identify number 2.
This is basalic vein.
This is cephalic vein. Very good. Okay, good. What is the importance of cubital fossa?
Uh,
Significance of cubital fossa.
Significance is like the important structures. We can palpate here the for the brachial artery, and the nerve is going through this median nerve is going through this fossa. And
Okay, we'll come back. If you can't answer the question, then you can say,
yes,
okay, we'll come
I
back
can
to
come
this
on this
question later.
later.
All right. Can you tell me, because the most lateral content of the cubital fossa is the biceps tendon, kindly tell me the origin and insertion of the biceps tendon, please.
Biceps has two heads, long
Yes,
heads as well, long head and short head.
very good.
Lo
And
the origin of long head is from the supraglenoid tubercle,
yes,
and the origin of short head is from the coracoid process.
yes, please.
From the
Insertion is
and the insertion is over the that radial tuberosity.
yes, okay. And this muscle is innervated by which nerve?
It is innervated by the musculocutaneous nerve.
Okay, we're moving forward. Can you please tell me what are you looking at? If
I'm
you
looking
look
at,
at the right-hand side, picture A.
yes, I can see the anatomical snuff box
Yes,
in
please
this
tell me the
picture.
boundary of anatomical snuff box.
It has boundaries medially and laterally. The medial border is formed by two muscles. One muscle that is extensor pollicis longus, and laterally it is formed by the two muscles, the abductor pollicis longus and extensor pollicis brevis.
Okay,
And
yes. And
and
the
the floor
contents.
yeah, the floor is formed by the uh, radial styloid process and the trapezium bone.
And
And the contents it includes radial artery as well as
yes, radial
posterior.
artery.
Yes.
Yes, what is the significance of anatomical snuff box? Why should you
Uh,
know about it?
there is a possibility of a scaphoid fracture, and the tenderness is present generally in this area.
Yes.
We can clinically assess if there is a injury to this scaphoid bone or not,
Or the
present or not.
tenderness in the anatomical snuff box. You can rule that
Yes.
out clinically.
Yes.
Very good. Okay, can you tell me why is it important that you should know about the fracture of the scaphoid bone?
First of all, because initially it is not picked up in the X-ray
Yes,
because
initially.
of it
Yes.
because it has a retrograde flow of blood supply from the palmar branch of the radial artery, and then because the most commonly the proximal part of the scaphoid bone is uh, 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 hampered from the blood flow because it is
Answer you're
easily
not giving me. Okay, blood flow has
because of
been
a
hampered, then
bec-
it results
because
in
of
avascular necrosis.
avascular
Very
necrosis.
good.
Yes.
This I wanted you to tell me. Right. Moving on to, if we come on to the picture B, can you tell me which tendon is this number 3 is trying to point out or
This is extensor digitorum tendon.
okay. Can you tell me how it inserts in the fingers or the digits?
It is inserted over uh, the base of the distal phalanx of
How?
second, third, and fourth digits,
Okay.
and it is going through the tendon. It is going through the tendon of extensor superficie.
What
I'm
happens if we can come back to that later. Okay. If you
yes,
can come over here on the picture B on the side, this is
yes,
16. This
yes.
structure, can you please identify it?
This is extensor retinaculum.
Please tell me the attachment of extensor retinaculum.
Medially, it is attached to the this ulnar styloid process, and laterally it is attached to the radial styloid process.
What are the structures which passes below it or
The
above it?
structure,
Yes.
the structures which passes below the extensor retinaculum is the six compartments of the extensor muscle, which are enclosed in the extensor sheaths, uh, and as well as the radial nerve which is passing. So, cutaneous branch is passing superficial to the extensor retinaculum.
Okay, if a person falls on an outstretched hand and injures wrist, what nerve injuries do you suspect or would you think of?
It could be the ulnar nerve injury
Okay.
or
How
or
would a patient present? How would you confirm ulnar
the
nerve injury with the injury
patient
at wrist? Yes, please.
uh, injury at the wrist. The patient will present with the claw hand with the flexion at distal interphalangeal joints of fourth and fifth finger, and
Good. Yes.
extension of metacarpophalangeal joints and
And
fourth and fifth levels, as well as there is a sensory loss of skin over the lateral over the middle one third of the palmar as well as dorsal aspect of the hand.
right, right. Okay. Here again, on the right hand side, I would want you to, bell is gone, but I would want you to identify structure 19.
This is flexor retinaculum.
Okay, yes, and the attachment.
Uh,
Again,
uh,
carpal
la-
tunnel syndrome can be asked. What is the
laterally,
condition? Yes, please, sorry.
laterally, it is attached to the tubercle of the scaphoid, and below it is attached to the trapezium, and medially it is attached to the hook of the hamate
And
and pisiform bone
yes,
and pisiform.
okay. And what are the structures that passes below it?
The total nine structure which passes below
Yeah,
this, they are the four tendons of flexor digitorum superficialis and the
yes,
four tendons of flexor digitorum profundus,
yes.
and one which is passing below is flexor pollicis longus,
Okay. What about the
as well
median
as
nerve?
median nerve. Yes, as well
Yes,
as median nerve.
right. And if you can identify structure 29.
This is a palmar arch, palmar-cutaneous
Superficial.
arch.
Yeah, or
Yes.
superficial palmar arch. It's the continuation of which vessel?
It is the superficial division of ulnar artery, and it is
Very good.
completed by
Yes,
the superficial palmar branch of radial artery.
very good. Okay. There is one identification thing, all right. What more can be asked? Okay, in picture A, on the left-hand side, if you can identify structure 16.
This
Please.
is median nerve.
Okay. If you can identify 9.
This is 9 is muscle, flexor carpi ulnaris muscle,
Tendon.
a tendon of flexor carpi ulnaris
Yeah.
muscle.
All right. Okay. Can you, last question because Bella is gone. If you can tell me what are the movements which are possible at the thumb? Here, looking at picture A and thumb.
Yes, this is an adduction, and other movements which are abduction,
Yes.
flexion, extension, and opposition.
Considering the thumb, where does the tendon of flexor digitorum superficialis and flexor digitorum palm profundus they are inserted in the digits?
In flexor digitorum superficialis, they are inserted into the in the base of the middle phalanx of second, third, and fourth
Okay.
fingers.
Yes. Yes.
And the tendon of flexor digitorum profundus, it pierces through the tendon of the FDS,
Yes.
flexor digitorum superficialis, and
Yes.
inserts over the base of distal
Well,
phalanx
very
or
good.
first, second, third, and fourth phalanx.
Yes. Good. Okay. Since it's going, okay. You told me about the movements of the thumb. Which nerves supply or are responsible for the movements of the thumb?
Okay. First of all, flexion is done by two muscles. That is
And median nerve?
median nerve. That is flexor digitorum. Flexor pollicis longus and flexor pollicis brevis. Yes, and flexor pollicis brevis and longus both. Yeah. And extension is done by the extensor cubital muscle, which is spread by the radial nerve.
Yes.
This is the and opposition is done by three muscles. This is flexor pollicis brevis, abductor pollicis brevis, and opponens pollicis. And all the three muscles are supplied by the median nerve.
Very good.
And adduction is done by the adductor pollicis, which is supplied by the ulnar nerve.
Yes. And abduction?
And abduction is done by muscle abductor pollicis longus and abductor pollicis brevis. The longus is supplied by the radial nerve.
Yes.
And abductor pollicis brevis is supplied by the median nerve.
So, by this, you can conclude that thumb alone is supplied by the all three.
All three nerves, yes.
Yes, good. Right. With this, we'll end. Thank you.